Absolutely essential to the outcome of this study is the follow-up.
The families who participate in the MOMS study come back at 12 and 30 months of age for the baby for follow-up.
But in between time, there's telephone conversations every 3 months. We want to hear about what's happening with your family and your child.
They must now reestablish relationships at the community level with a pediatric neurosurgeon, pediatric urologist, spina bifida clinic.
So all these caregivers back at the patient's community are an incredibly vital part of this study. And we couldn't do it without them.
At the 12-month visit, the families would come back to the center in which they had either the prenatal repair or the postnatal repair and undergo an examination of the baby by an independent team of pediatricians and neurodevelopmentalists.
Along with a regular physical exam, just like a child would have it with a pediatrician, there are other tests that a family wouldn't be familiar with. These test how a child is developing with regard to their social skills, their motor skills, not only their gross motor skills, like how well they crawl or step, but their fine motor skills, how well they can pick objects up, how well they can stack blocks. And so we not only want to know about how the child is doing physically, but how developmentally they're doing.
We provide a MRI of the head and spine. We provide renal ultrasound. We provide an X-ray of the spine that will determine the actual level of the infant's lesion. And we also do urodynamics, which all of these studies are given back to the families. All the imaging is downloaded on a CD so that they might take that back to their care providers at the local level and be used as a clinical tool.
After they leave at a year of age, again, we'll keep in contact with the families every 3 months, getting information. We want to hear from families if something happens or if they have questions. And we have them back again at 30 months of age.
It gives us a better picture when the baby's a little bit further on, now 2.5 years old. What are they ambulating? Are they not? How is their bowel and bladder control? Have they had a shunt? Have they not had a shunt? And so all of these areas are retested by that independent team again.